So you guys know that I like to sort of hit things 2 weeks in a row, generally speaking. So we did talk about this last week. You know, the major issue we're on right now is vaccination, right? We're on vaccine hesitancy. We're seeing that the vaccine availability is becoming greater and greater. So we're on the whole idea of how can we get more of our employees to get vaccinated? Should we be tracking vaccinations? I think we've sort of beat to death the idea of whether or not we should make vaccines mandatory. We talked a lot about carrot and stick. You guys know I'm on the carrot side of that. But now that your employees are actually getting vaccinated, oh, and let me touch on one more thing about vaccine hesitancy. There are some videos being put out now. We came across some from the FDA, and we can include links to those in the email that goes out after this. So as you're starting to think about your education campaign, the bottom line is your employees who really, really wanted the vaccine, they're getting it, right? They're either fully vaccinated or they're about to get their second dose. Then you've got your employees who probably will never get the vaccine, right? That's hopefully a small percentage. But then you've got your folks who are on the fence. So what can you do to push them over, so to speak, to get them to get the vaccine? And that's, you know, the incentives that we've talked about before. Some employers are offering bonuses. Some employers are offering PTO. Some employers are offering different types of incentives. To get their employees to get vaccinated. So what can you do to push them over the edge? Part of that is probably an education campaign. So like I said, we'll send around some links to some videos with the email that goes out after this. Another thing that you can do to encourage people to get vaccinated is to help them get it done as easily and quickly as possible. And so helping your employees find vaccines. I know that some employers are actually starting to do some vaccination clinics. That's something you heard our representative from the Department of Health come on last week and say DOH is not getting involved in that in Pennsylvania, but there are private pharmacies that are doing this. So get in touch with your contact who does your flu clinic if you do one. Talk to Rite Aid, talk to CVS, talk to Walgreens, see if they'll come in. Chances are they're only going to come in if you have enough people to justify them coming in, but maybe that works too. I think there are a fair number of people out there who are only going to get vaccinated if it's as easy as possible. So something to think about. But then the question is, what do you do around the vaccinations? We've all heard that at least with the second dose of Moderna and Pfizer, there can be some adverse reactions. People don't feel so great for a couple of days. So what do? We encourage people maybe to get their vaccine when they're not going to be back in the office for a couple of days, when they have a couple of days off in a row. We also try to help our employees. If we've got 10 employees in a department, let's not get everybody vaccinated on the same day, right? Let's stagger those appointments so that in case everybody does have an adverse reaction, everybody's not absent the same day. But then what about, how do you tell the difference between this is a COVID reaction? Maybe I got COVID in between the time I got vaccinated, or this is just maybe a reaction to the vaccination, or maybe it's something else. So this is CDC guidelines. If an employee has any signs consistent with COVID, exclude them from work, pending evaluation by a healthcare provider. Criteria for returning to work depends on the suspected or confirmed diagnosis. And if the employee has signs and symptoms that could be from vaccination, they could be from COVID, they could be from another illness, employees who meet the following criteria may be considered for return to work without testing. They feel well enough to work. They don't have that fever. They don't have other signs and symptoms of COVID. And we all know by now what those signs and symptoms are. If the symptoms don't improve in 2 days, the employee should be excluded from work. Consider COVID testing. Employees with fever ideally should be excluded from work pending further evaluation, including possibly COVID testing. All right. And then, let me see if there are any questions on that before I shift gears a little bit. So somebody's asking, can have vaccinations on site open the company to any lawsuits? I would have that conversation with your general liability carrier. I don't think it's any different than having a flu vaccine on your site. Keep in mind, if you do have mandatory vaccines and somebody has an adverse reaction, that could be a workers' comp event, something to think about. Someone else is asking, can we tell employees we will reduce social distancing requirements after most or all the employees are vaccinated? I would wait until CDC says that's okay, till the state that you're in says that's okay. I know everybody wants to take the masks off. Everybody wants to stop the social distancing, but I think we keep hearing, in another 30, 60, maybe 90 days that CDC is going to start to ease back on some of these guidances. I think what we'll hear probably in the next week or two is the reduction of the use of masks outside. And then hopefully we'll get behind that with regard to masks inside as well. Okay, so I wanted to switch gears a little bit. EEOC, and EEOC is the Equal Employment Opportunity Commission. It's the federal agency that handles claims of harassment and discrimination at work for an employee or for any individual to file a claim of harassment or discrimination in federal court. They have to go through the EEOC first. So every year EEOC releases their statistics, and I have a lovely typo there. It's not the year 2020. It's the year 2020. They release their statistics. Their fiscal year runs from September to September. So basically fourth quarter through the first 3 quarters of the following year. So these statistics don't have much, they kind of started in the middle of, they only have some COVID in them, put it that way, that the entire time was not affected by COVID. The number of actual charges overall, 67,448, is down. Year to year, we had a real peak during the Great Recession, 2010 to 2012. For the most part, that has been trending downward. The only difference was 2016. We had a little spike upward. But for the most part, what you find is your number of charges go down during a good economy. Your charges go up during a bad economy. So it'll be very interesting to see when we get these statistics for 2021, do those look any different? And then the amount of money the commission secured for victims of discrimination, 440 million. That number is fairly consistent. Actually, is probably tending to go up. What the commission has tried to do over the years is to focus their attention on the more systemic, bigger money situations to collect more money for the potential victims. And then these are the, I didn't give every category, but this is sort of what, so you can see what the breakdown is. 55.8% of charges filed have a retaliation component to them. And if you guys have ever done any anti-harassment training, we talk about this at MEA during our anti-harassment training. It's not always the crime, it's the cover-up. Retaliation is always going to be the biggest percentage of charges filed. And then after that, not surprising, your biggest 3 categories are almost always disability, race, and sex. A little bit of a fall off there to age and then to national origin. Age, keep in mind, tends to go up when the economy is bad. So I wouldn't be surprised if the 2021 statistics show that age claims go up. Because what happens is you have layoffs, which a lot of employers had layoffs in the last year. Older employees tend to get laid off more, and they tend to have more trouble finding another job. So what do you do with all of this information? It's a great time. I know that we've been so concentrated in the last year on the pandemic and to keeping businesses afloat. And now a lot of places are hiring, and so they're concentrating on that. But we can't ignore this piece of things as well, the discrimination and harassment. So review your anti-harassment discrimination policies, review your complaint policies and procedures. And again, another opportunity for training. If you haven't done training in at least 2 years, now is the time to get that back on the schedule. There is virtual training that can be done if you're not fully back in the office yet. And keep in mind that some states have training requirements. So if Pennsylvania, New Jersey, Delaware do not, or I'm sorry, Delaware does. New York does. So depending on where you have your employees, you may actually be required to do some training. So if you haven't done your training in a little while, you have any questions, give us a call here at MEA and we can help you with that. And then we do have something that we're putting out, a return to workplace guide. This is something that I put together, just sort of talking through the issues and compiling the different information. So this is you see there that the bullet points are the overview. This is something we'll be getting out shortly for our members to take a look at, to issues you may or may not have considered, because we did see, I think it was last week, we saw the results of our poll, or maybe 2 weeks ago, we saw the results of our poll with regard to when employers are looking to get their employees back. And although a lot of members or a lot of employers who responded were undecided, a big majority were planning to get back by September. So these, you really need to be thinking through all the issues that come along with that and make sure you're planning ahead for all of that. All right, so that is all that I have for the week. Any questions? Okay, somebody just chatted in that Acme has a great program for vaccine clinics and that Margaret Ulrich at MEA apparently has the information. So if you do want information regarding a vaccine clinic potential, we can probably get that for you. Maybe we can see if we can include it in the email that goes out after this. Yeah, I know somebody's asking that question about reducing the social distancing. We want to offer it as a motivation to get the vaccine. So think about different things you can offer as motivation to get the vaccine. So I've been talking to a member, one of my great members who's a really outside the box thinker. They are manufacturing, they have been there the whole time. When COVID hit, they decided to go above and beyond the mask mandate. So they had their employees wearing masks and face shields. And so now that once they hit a certain percentage of vaccination, they're going to take the face shields off. Okay, because that's okay under CDC guidelines. So I get it that you want to do things. Is there a celebration that you could do? Could you bring an ice cream truck on for the day and socially once you get to maybe 75 or 80% vaccinations, could you do something like that and do it in a socially distant way, but just do it in a way that celebrates your employees and what they're doing. What you don't want to do, obviously, is get into a situation where employees are starting to harass each other about vaccination. It's, gentle peer pressure is a great thing. Can cross the line, though, sometimes into something a little bit that can cause controversy in your workplace. So, all right. Looks like those are all the questions that we have for the week. So I want to remind you guys, if you have any thoughts on topics you'd like to see for future, please, feel free to chat them in now, or you can respond to our email when we send out at the end of this afternoon or tomorrow, the wrap up, and let us know. And then I did have one other thing. Last week, somebody had asked a question about New York law. So if that was you, don't drop off. Or if you have employees in New York, the question was, so New York has its own form of FFCRA around paid time off to get one of the things is to get a vaccine. Somebody had asked last week. So if an employee goes on their day off to get the vaccine, do I have to pay them? Do they have to get that extra paid money? The answer is no. Just like with most sort of paid time off situations, if an employee does something on their own time, you don't have to pay them for that time under that New York law. Okay, so thank you guys so much. And thanks to Sean again for his great presentation this week, and we'll see you all next week.